In 2013, a group of researchers explored the differences in the number of men and women diagnosed with depression. In this presentation, we will explain what and how the researchers studied, as well as what they found. Other articles were written trying to explain the study simply, but their explanations may have been too simple. We hope to explain the study simply and completely. Enjoy!
This study was written because researchers saw that women are diagnosed with depression much more often than men. The researchers wondered if this was because men show different symptoms of depression. The point of this study was to look at the different symptoms men have, which the researchers called alternative symptoms.
To diagnose depression, doctors and psychologists ask patients if they have been experiencing certain symptoms. Usually, they ask about the traditional symptoms, which are presented on the left side of the screen. Traditional symptoms tend to be internalized, meaning that a person may not express the emotions in a way others can see, but instead just feel them on the inside. For this study, researchers looked at previous research which showed that men may show externalized symptoms, meaning that they express their symptoms in ways that other people can see. This led the researchers to choose a list of alternative symptoms which they guessed men would show. These symptoms are listed on the right side. By adding these symptoms, researchers thought that they would be able to diagnose with depression more accurately than just considering the traditional symptoms which women tend to show. How did they study this?
The researchers used a survey called the National Comorbidity Survey Replication, NCSR, which had already been given to 5,692 people, including both men and women. The NCSR is made up of many questions that diagnose the men and women with depression. The researchers looked at these questions and determined which ones show the presence of traditional and alternative symptoms. Next, the researchers created 2 new ways to determine who should be diagnosed with depression. One way was just using the alternative symptoms. This means that the researchers looked to see if participants experienced externalized symptoms, and if they did, they would be diagnosed. The other way was by combining the traditional and alternative symptoms to create a way of diagnosing that includes all possible symptoms. The researchers looked at both men and women according to the 2 ways of diagnosing. What did their results show?
The researchers found that their list of alternative symptoms made the number of men and women diagnosed with depression more equal. However, the results also showed that both men and women experience both traditional and alternative symptoms. Men tended to show alternative symptoms more often than women, but also experienced traditional symptoms. In fact, the most common symptoms in both men and women were the same.
This study is important because it suggests that there are other symptoms that should be considered when diagnosing depression, especially in men. Currently, the traditional symptoms are what doctors and psychologists focus on. However, this study shows that these symptoms may not be enough. Furthermore, these results can reduce the gap of men and women diagnosed with depression, and therefore reduce the idea that depression affects women much more. It is important that men are diagnosed using the most accurate list of symptoms. Therefore, this study was an important step in increasing attention to the many different experiences of depression.
We hope you enjoyed our presentation and that it helped you understand what the study is all about and what it means for you.
Thank you.